Hey, I'm Dr. Joffrey, emergency medicine physician, giving it to you in 5 minutes or less. Strokes may present differently in men. Again, strokes may present differently in men. Just real quick, there are two main types of strokes. One of them is called an ischemic stroke, which means there's a lack of oxygen to different parts of the brain, and brain cells begin to die within minutes. And then there's a hemorrhagic stroke, which means that a blood vessel has ruptured in the brain. Strokes may present differently in men. For instance, men are prone to have sudden confusion. None of the typical signs of weakness, none of the typical facial droops. They're just suddenly confused. They may have trouble understanding speech, as in you're saying something to them and you're looking at yourself saying, do you understand? Well, no, because of where the stroke is and how it is, they don't understand. They may have visual losses in one or both eyes. Again, visual losses in one or both eyes. And they may have weakness on one part of the body. We're going to talk about the fast signs, but then they may have weakness on just the arm or just the leg. They present differently in in men. And instead of having any weakness at all or any slurred speech, they just may have dizziness, sudden dizziness, or difficulty walking. Don't know why. They just have difficulty with walking and they're suddenly dizzy. They've got loss of coordination. Hey, they just can't stand still. And if it's a hemorrhagic stroke, and this is true of anyone with a stroke, one of the telltale signs is sudden piercing headache. Again, a sudden piercing headache. Now, just to summarize, the most common way that laymen should assess strokes in males and females is something called FAST. F-A-S-T, FAST. One that's F, look at their face. Is their face symmetric? Is it equal? Is there a droop? Or a good example would be if they smile. Are they only able to smile on one side of the face? Such as they're smiling, but you notice that this side, is not going up. Next one is your arms. You ask them, hey, raise your arms. And they raise the arms, but only one goes up. That's the A, the arms. The S, speech. They may not be able to speak. Or what they speak, it may come out, does not make sense. Or this is a simple one that people miss. They keep saying the same thing over and over. They want to say something different, but they're not able to. They keep saying the same thing over and over. And then the T, time. Call 911 right away. Call 911 right away or get them to the emergency department right away. This is one of the few areas, as I talked about in previous videos on stroke, where time is of the essence because you have a window in there, a window of about 3 hours, that you can receive clot-breaking medicine if it's not a hemorrhagic stroke, and that improves your outcome. Now, if it's a hemorrhagic stroke, time is of the essence as well because there's some procedures that may need to happen as soon as possible. I get this one a lot being an emergency medicine doctor. They say, hey, my stroke symptoms have been present for greater than 3 hours, so I decided not to come, or I decided to delay care. No. Please come as soon as you have stroke symptoms because you may be outside the 3-hour window. However, there are other things that we can do even above 3 hours. Don't want to be too technical. And not only that, if you had a stroke, it's very important for you to still come, even if you're outside the 3-hour windows, because we don't know the cause of that. And it can be something that's fixable that will prevent you from having another stroke. If you found this video helpful, be sure to hit subscribe, leave a comment, share. Thank you very much for watching.